Welcome to Morning with Court with me, Amanpreet Kaur. Today I'm here with Dr. Costa to discuss neurofibromatosis type 1. Neurofibromatosis type 1 is more commonly known as NF1 and is also mistakenly known as Alzheimer's disease because of Joseph Merritt, who actually had Proteus syndrome with a mild case of NF1. Dr. Costa, our viewers would like to know how NF1 got its name.
Well, NF1 got its name from the effect on the NF1 gene on chromosome 17. The disorder causes a mutation of this NF1 gene, which typically codes for a protein called neurofibromatosis. However, when this mutation occurs, the neurofibromatosis cannot bind to the RAS protein, which usually causes abnormal growths and uncontrolled cell growth.
So you say abnormal growths. What are the other symptoms?
Well, there's a lot of symptoms actually. It's cafe amyloid spots all over the body. There's freckling on armpits. You have actually like tumors or little like bumps on the irises of your eye. You also can have soft bumps all over your skin. Bone deformities, tumors on the optic nerve. Also, you have learning disabilities and abnormal size of your head, which is usually larger and a shorter stature.
In the U.S., there is a case of NF1 for every 3,000 to 4,000 people. What do you have to say on that topic?
Well, even though it's a rare disease, it actually does affect a lot of people. And surprisingly, it's equally common in males and females.
Hello, my name is John Merrick. I'm very pleased to meet you.
I'm very pleased to meet you, Mr. Merrick.
I am not an elephant! I am not an animal! I am a human being!
Welcome back to Morning with Court, where we are discussing NF1 with Dr. Costa. In most cases, individuals with NF1 lead normal, productive lives because their symptoms are mild. However, in some severe cases, the life expectancy can actually be shortened due to complications such as cancer or psychological and cosmetic issues. Can you explain the genetics?
Well, there's issues with nervous tissue, and also there's a mutation on the NF1 gene.
Is there more than one type of this disease?
Yes, so there's NF2, which affects the cranial cavity, which is the inner ear to the brain, and now there's small tumors that develop on this nerve. And then also we have NF3, which affects, which causes tumors to grow on the spinal cord in the brain, and also on different nervous systems in the body.
And that's also known as schwannomatosis, right?
Yes.
We're going to cut to commercial break, and we'll see you soon.
Sponsored by
King Costa Court.
The king of all seafood.
Welcome back to our segment on NF1, which is thought to have an autosomal dominant pattern of inheritance. It occurs in both genders and across all races equally. What are the treatments for this disease?
Well, there are currently 2 treatments for the disease. You can have surgery to remove part of or a whole tumor, and there's also radiation that targets a specific tumor and shrinks it or removes it entirely, and that one is not as successful and requires no incision.
So I know you're not only a doctor, you're also a research scientist. Where's the research for this disorder heading?
Well, currently we're working on mice, and we're trying to delete or suppress the NF1 gene. This way it does not cause tumors, but ultimately we just want to halt or slow the growth of these tumors in all the patients.
Well, that's very interesting and very helpful. It was great to have you on our show.
Nice meeting you. Thank you.
We will be back soon with an interview with someone who actually has NF1. See you soon. Hi David, so we're going to ask you a few questions. Are you ready?
I'm ready.
What was it like growing up?
It was a hard childhood. I mean, I have a lot of learning disabilities, so it's hard to focus. And I always felt different, like I wasn't concluded into the group.
What do you deal with on a daily basis?
I get a lot of headaches, and sometimes on some bad days I get seizures a lot. And then I always have my parents have to check my blood pressure to make sure it's not high, because constantly it's always high.
What treatments are you currently receiving?
I always have to go back to the hospitals. For my tumors, I have to make sure they're not cancerous. I have to go sometimes to the eye doctors, make sure everything checks out. Sometimes I have to get ear implants if it's necessary, if he decides to.
What sources do you receive support from?
Well, I joined a support group. They help me feel included and feel like I'm not alone in this battle. I also get some support from my doctors. They're always encouraging me, telling me to keep going, and that's pretty much it.
How does your family respond to your disorder?
Well, my family had to get counseling at first. They were really distraught about what happened. But now they're finally behind me, supporting me, just like Donald Trump and Barack Obama, who also supports NF1 research.
How much does it cost annually?
Well, the test alone for that, to test for NF1 cost around $1,200 just to test, and then annually after that it costs $1,200 alone.
And that's without surgeries you may receive.
Yeah, without anything, just $1,200 annual care.
All right. Well, thank you, David. That was very helpful.
Thank you.
A word from Claudia. Please understand if you see anyone in this situation, do not judge a book by its cover. Understand that there is a backstory to every person and every situation that they are in. These cafe au lait spots are not just birthmarks, but rather a hint to a serious illness that they have, a rare disease that affects them day in and day out. Please support them and do not judge. Thank you.
What? You didn't count down. You're for a moment. No, that's not. I'm sorry. Do you start going faster? NF1. I just like my brain just went.
It happens.
Oh my god, I can't. It's so wrong.
Directly at the camera. Yeah, while you're videotaping.